Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and thank you for joining us here today. Today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement the expertise in medical care. The areas of focus are in preventative medicine, holistic health, and weight management. Today we have with us Dr. Mahsa Ostavarnia. Welcome, Dr. Mahsa. It's a pleasure to have you here with us.
Thanks for having me.
Dr. Mahsa is a functional medicine practitioner and a chiropractor at Virginia Family Medicine. She earned her bachelor in biology from George Mason University and went on to complete her doctorate degree in chiropractic care from Life West in Northern California. Her studies led her to mentoring with one of the pioneers in functional medicine, Dr. Kalish. In the Kalish method, which solves many health challenges through specific lab testing, it addresses three key areas of hormones, GI, and detoxification. More recently, Dr. Mahsa proudly served as an active member in the Functional Medicine University, International Association of Chiropractors, California's Chiropractic Association, and the League of Chiropractic Women. Also in 2015, she was selected as one of the top worldwide leaders in healthcare in the Silicon Valley. It's really an honor to have you here with us, Dr. Mahsa.
It's my pleasure. Thank you.
Yes, thank you again. So today we're going to be discussing adrenal fatigue. So adrenal fatigue has been a buzzword in functional medicine. Tell us a little bit about that. Is that actually real?
Yeah, actually, it's a buzzword these days. Everyone is under one form of stress or another. Okay. A certain amount of stress is pretty normal and is healthy. As a matter of fact, if you don't have that much enough stress to function, you won't be productive, you won't be alert enough to work and do your daily basis activities.
So enough to push you, but not enough so that you're sick.
Exactly. However, extreme amount of stress can cause so much damage to your body. As a matter of fact, it is causing a negative effect on your health and cause adrenal fatigue, which many people in our modern society with this type of lifestyle we do have facing it. It's very common.
Okay, so tell us a little bit about what the adrenal glands actually do so that when you have this adrenal fatigue, what is it that's, that causes?
Sure. Before I start, I just want to point out in conventional medicine, when we refer to adrenal fatigue, usually it's the same line of adrenal failure. We are not talking about the same exact condition because adrenal failure is a pathology and it is the end of the spectrum of not having any adrenal hormone in our body.
Okay.
So before we start, I just want to point out, so we are not talking about that specific problem. We are talking about a functional range of adrenal hormone in our body. As you know, picture shows there are two triangle glands, each sitting on top of your kidney, and it's working 24/7.
Okay.
There are many layers, many hormones producing by this gland. And the outer layer, the cortex, producing aldosterone, testosterone, and 80% of the hormones are producing is cortisol. Cortisol is the stress hormone, something that we don't measure normally because there are different ways of measuring it, and it's not normal in a routine visits with our family physician that we go. And it's very critical to know how much burden we put on our adrenal glands.
Okay, so if the cortisol levels then are increased, which is made by the adrenal glands, then obviously you're putting that pressure on there. So more stress, you're putting more pressure on the adrenal glands.
Yes, actually, yes. It does give us energy and it surge, and it just prepare us for stresses that coming and facing we are daily, but we have to be prepared for it. And there are many ways, there are different types of stress that we should remember during the day.
Okay, right. So of course there's any range of stress that can happen throughout your day, but what type specifically would you say what may affect the adrenal glands?
Yes, there are three main type of stress that impact our body. Okay. First is physical stress. For example, you have car accident or you run a marathon. do any active, intense sport activity, your cortisol, your stress hormone spikes. And the second type of stress is a mechanical one, which is the emotional one as well. Most people know an emotional one as well.
Okay.
And the other one, last but not least, is the environmental. Environmental stresses are such as pollution, pesticides, and carcinogens. We are daily exposing to it, and we don't know that how much of it we are putting in our body.
Okay, so not all of them are negative. Like you said, if you're running a marathon, obviously you need that cortisol level to help you give you that energy. Okay, but tell us a little bit, what are maybe some hidden forms of stress that can cause us to become sick as well?
Yes, there's always hidden causes of stress. One of the main one is food allergies.
Okay.
It put a lot of pressure on our system, in our gastrointestinal system, that made us getting sick. We don't know what's going on, and it's some of the foods that we are taking. And also can be lack of oxygen or low oxygen level. People who have sleep apnea, it's very common. Their brain don't get enough oxygen. As a result, their cortisol spikes super high, and they don't feel relaxed, they don't feel rested in the morning, although they had 8-9 hours of sleep because of the lack of oxygen. The other type of stress can be spotted mostly is inflammations. You have any infection, dental infection, sinus infection, anything like that in body, it just can add more stress to your system.
Okay, and so what would be the result of this? Why should somebody be concerned about having an increased amount of stress?
Yes, unfortunately, it just starts little by little. Some people just start having mood swings. Some people crave salt, sugar, something we feel it's normal. And eventually it gets to our hormones, hormonal imbalances, sometimes blood sugar imbalances. We get fatigued, we get tired all the time, and we have poor sleep patterns. At the end, many people have poor immune system. They get sick all the time, and they don't know why they get getting sick. All of them together shows these symptoms are telling us there is something wrong with the whole system. Functional medicine comes in this place that telling us functional medicine is not medicine by symptoms, it's medicine by cause. So we have to find out what is causing all these problems and symptoms in order to address and fix it.
Okay, so these symptoms may be causing somebody to be feeling burnt out. Is there anything that can be done?
Absolutely. There are many reliable tests out there. One of the easy one for patients we recommend is the saliva test. So it's not just a snapshot of the hormones. We give little bottles, as you see in the picture. There are tiny bottles that you take home. 4 times a day you collect your saliva, and they run a test, and they can measure all your hormones regarding your stress, ADHD and cortisol, and the ratio. By the calculations and the graph, we can start and finding what time of a day you have the most trouble and what level is your cortisol, if it's too high or under functional range, so we can help you out with that.
Okay, and then are there any other specifics to know exactly how we would know that that is occurring?
Absolutely. There are so many functional range that we have to look at it. The numbers are telling us if it's too high in the morning, so it means you're awake in the morning, but if it's too low, it seems you are just don't have energy to start your day. So by looking and comparing to the functional range of your cortisol level, we can start helping you with that.
Okay, so it's basically just trying to figure out the ranges and where you're at with your adrenal glands if you're having these types of stresses.
Yes.
And then is it referring to a primary care or another type of specialist that you would recommend for a patient?
In this case, usually functional medicine doctors are well trained to address the issue and help patients with not too many visits to the doctor's office.
Okay.
And it's pretty successful so far, and all the research coming out that is getting advanced and people all in our modern lifestyle, we all do need that.
So what would be some type of treatments that a patient would consider?
The treatments are different because some people cannot handle any hormone, so we have to go holistic. We have to go based on some medications that they don't have any animal products, any dairy products in it. Based on the body, every individual has its own system. So we have to address everybody based on their needs and their body. People who have, for example, breast cancer in the past, we are not going to give them the same exact treatment as a young guy probably is like running a marathon or something. So it's different among any patients.
Would you maybe recommend somebody who feels like they are feeling burnt out, but maybe they're not sure if this is caused by adrenal fatigue? I know a lot of people like to keep diaries maybe for food, but would you recommend maybe like a stress diary? Might that be a good idea for somebody who's having this?
Very good question. Before we start any treatment, we run extensive labs, sometimes a long history of patients and daily activities.
Okay.
It takes about an hour to start the treatment, and that's a personal medicine that comes. Functional medicine is a personal medicine. So we have to collect all the information before we make any decisions on helping patients.
Okay, and how long of a process could somebody expect until they're starting to feel a little bit better if it is something that's caused by your body and not just by environmental factors?
Sure, it's not too long. In 2 months, people feel the results. Sometimes first week, people who just start their treatments, they don't feel any more foggy brain, they can focus better, their sleep pattern starts the first week of the treatment.
Okay, and would there be a specific symptom that you might encourage for a patient to keep an eye out on? If they say, okay, if you have this, then it might be caused by the adrenal fatigue. Is there a key symptom that we could take away from?
Sure, it's mostly when your hormones, you don't feel losing weight. Okay. So you're doing all the instructions, but you still feel you're gaining weight. That's one of the key factors. If you sleep and you don't feel rested, or you don't feel like getting up in the morning, if you have mood swings without knowing what's going on, mostly check your hormones. All your hormones should be balanced. If it's not, there must be underlying cause. Also, not all the cortisol imbalances are due to low cortisol or high cortisol level. We have to find out. One of the other problems that patients have, their blood sugar. Their blood sugar goes up mostly because of not the diet, because of the stress and cortisol imbalances. So those are the main symptoms that patients can look at.
Okay, so a lot of interesting information, a lot that we can take away from this. So thank you, Dr. Mahsa, for being here with us today. And thank you again for joining us here. I'm Alejandra Gonsalves, and this has been Virginia Medical Updates. We hope to see you again next time.